Good morning, everyone, and welcome to our quarterly Senior Town Hall meeting. And I am Debbie Quaid. I'm the chair of the Senior Affairs Committee of Miami Beach. And our goal is to listen and reach out to the seniors of our community and to make recommendations back to our mayor and the commissioners how to enhance and enrich their lives. So we welcome you all to our quarterly town hall meeting. And this morning, we're going to be speaking with Dr. Cornell Lupu from Mount Sinai Hospital regarding the vaccine. Morning, Dr. Lupu. And we're going to have some great words from our mayor, Dan Galber. And then the entertainment section. We have fabulous, our darling Molina and Tito Puente Jr. is here with us also. So we welcome you. We welcome all of the residents of the city of Miami Beach that have joined us this morning. I'm going to introduce our co-chair for the Senior Affairs Committee, Oscar Lorente. And Oscar is the Director of Network Development, Community Relations Outreach for Mount Sinai Hospital. Oscar?
Great, thank you, Debbie. Good morning, everyone. I'd like to take a moment to introduce Dr. Cornell Lupu. He's been here at Mount Sinai for many, many years, practicing internal medicine since 1977. I can proudly tell you Dr. Lupu has been selected by his peers as one of the best doctors in America since 1996. Now, without further ado, I'd like to introduce you to Dr. Lupu, who's going to be talking to us today about staying healthy and getting your vaccine. Thank you.
Good morning. I was asked to give a 10-minute talk about whatever subject I was interested. And I thought one of the interesting subjects we have would be the transmission of the virus. So I'll talk about it. Essentially, the transmission of COVID-19 requires a live virus to reach a vulnerable anatomic site, that is your nose, in a person who is not vaccinated. I'm going to review an article that appeared in the Annals of Internal Medicine. It is a review regarding transmission of the COVID-19 based on articles published in the whole world. So in order to evaluate transmission, we have to know several things. Number one, how long does the virus live in the environment? Number two, what does the virus attach itself to? Number three, how does it get there? Number four, how long is an infected patient infectious? And number five, what are the statistics of the spread in the population? So let's start with number one. How long does the virus live in the environment? The bad news is that the virus can live up to 3 days on plastic and stainless steel surfaces. The good news is that the concentration of virus on surfaces is way, way lower than that concentration of virus in the nose, making it less likely to infect somebody. Also, the viruses die at the rate of 50% every 6 hours. So the likelihood of getting infected from surfaces is low. Another interesting factor is the viruses are sensitive to temperature. The virus. It does very well at low temperatures, but it gets killed after 5 minutes at 158 Fahrenheit. This is a temperature that's easily achieved in a sauna. So the Finnish and the Swedish know something about staying healthy. So what does the virus attach itself to? We all saw the pictures of the sphere with spikes or studs on it. We all know that the spikes are used to attach to the human cell. The virus enters in the human cell after attachment and wreaks havoc there. We know that the concentration of viruses is highest in the nose and the nasopharynx, which is right behind the nose, at the beginning of the disease. With time, the viral concentration increases in the lower respiratory tract, that is the lungs. We find that by checking the number of viruses in the phlegm that we cough up, we can get an idea of their concentration. Occasionally, we have to put a tube in the lung and suck out the phlegm to measure the virus concentration. So we learned from these evaluations that the nose is the primary site for the viral infection, and then it descends in the lungs. So for all these people who watching, wearing the mask as a chin guard, or at least leaving their nose out, is the wrong thing to do. The nose is the primary entrance into the body. The other question is, how does it get there? The virus spreads through respiratory transmission. It does so either through respiratory droplets that are larger than 5 microns, or through aerosol that are less than 5 microns in size. The respiratory droplets, on the average, drop to the floor within 6 feet. The aerosolized virus can remain suspended in air for long periods of time. Unfortunately, the studies have difficulties distinguishing between respiratory droplets and aerosol type of transmission. Nevertheless, there is abundant evidence that being near an infected person is a key determinant of the transmission risk. A detailed contact tracing study of train passengers in China showed that the attack rate was closely linked to both the distance between seats and the duration of the shared travel. A cluster investigation in South Korea showed that fitness classes which perform high-intensity exercise in densely packed rooms yielded most of the infections. On the other hand, a less crowded Pilates class, also in South Korea, yielded no infection. In both of them, one person or the person in charge were infected, and they were before having symptoms. So breathing hard spreads the disease if you don't wear a mask. Now, poor ventilation has been implicated in numerous transmission clusters, including bars and churches. By contrast, such events have rarely occurred outside, and that only when we had crowded people together. So crowds outside are not good. Studies have found that masking, both in a healthcare setting and in the community, decreased transmission of the virus. A study in China found that masks used in the household before symptoms development markedly reduced the risk for household transmission. All this evidence supports the dominant role of the respiratory spread of the virus. Now, there is weak evidence that doorknobs, elevator buttons, light switches, remote controls can transmit the disease. There are multiple cases where people got infected, although they're not in close contact with each other. In most cases, alternative explanations were found. We also know that live virus can be isolated after the period of infectiousness, which suggests that there is a minimum necessary amount of virus to start up an infection. And I'll touch on that in a minute. Based on what we know, we suspect that the levels of live virus remaining on surfaces are unlikely to cause infection. Although live virus have been isolated from saliva, from stool, and viral RNA from semen and blood, there are no reported cases of viral transmission via fecal, oral, sexual, or bloodborne routes. Bloodborne routes meaning through IVs, through transfusions of blood. How long is an infected patient infectious? Multiple studies concluded that infectiousness starts 2 or 3 days before the beginning of my phone. Okay. And it reached its maximum the day before symptoms onset and then declined rapidly over 7 days. A study of major outbreaks at a nursing facility in Washington found a viable virus 6 days before symptom onset and through 9 days after symptom onset. So fairly long period, but not as long as people think. Another interesting case came from Hong Kong. A patient with unrecognized COVID-19 was admitted to the hospital. 7 staff and 10 patients had close contact with him. He was eventually intubated, which meant that he was producing large amounts of virus. He was shedding large amounts of virus. None of the contacts got sick, but he had been sick for 7 days before coming to the hospital. So he probably passed that infectiousness timeline. Finally, an extensive study in Taiwan confirmed this period of infectiousness. In a detailed contact tracing study, no spread of infection could be documented 6 days after symptom onset. Now, patients with mild symptoms can shed virus for 22 days and as long as 2 months. However, these viruses are either dead or they are not being produced in significant amounts to infect other people. This is the reason why most institutions do not do nasal swabs after the patient has improved. Okay, and finally, what are the statistics of the spread in the population? On the average, an infected patient can spread the infection to 2 other people. It is interesting to know that only a minority of infected patients spread the virus. In Israel, 10% of the infected patients were the originators for 80% of the cases. So some patients do not spread the virus, while others are super spreaders. So the important points to remember are, number one, respiratory transmission is by far the dominant mode of transmission. Number two, direct contact with surfaces transmission is presumed, but likely only an unusual mode of transmission. Number three, although live virus has been isolated from saliva, stool, and viral RNA has been isolated from semen and blood donations, there are no reported cases of virus transmission via fecal, oral, sexual, or bloodborne routes. And the most important one, I think, is there is a period of infectiousness that starts usually 2 days before symptom onset, peaks at 1 day before symptom onset, and finishes at 7 days. And that's my talk. Does anybody have questions?
If you have a question, you can write it in the comments section on Facebook for all of you that are joining us through Facebook. If you are on Zoom, you can click the chat and we'll have Diana check and see if there are some questions and comments. Anyone on the Zoom, Molina, Tito, you can just unmute yourself. Diana?
Remember, there's no chat. It's raise your hand.
Okay, raise your hand. I'm sorry. Raise your hand.
Well, my talk was so comprehensive. Nobody.
Amazing. Doctor, do you have any idea what the plans are for the hospital, Mount Sinai, when someone can go visit their loved one? Is there going to be a certain amount of vaccination rate that's going to make that determination?
The the question is interesting. No, I don't know. I suspect that the first thing we probably have to get to the point of some sort of a passport with proving that you had been vaccinated. I think that becomes really the most important issue. Um, it, we have studies that are in the process, but we know from before that people who are vaccinated are much less likely to carry the virus. Or maybe they do carry the virus, but they're carried in such low level that they're not infectious. So vaccination is crucial.
That's very interesting because the perception has been you're vaccinated, but you're still carrying that virus and transmitting to everyone. It's interesting to know at least it's a little bit of a protection with a lower dose.
Right. There is a very interesting schematic, a diagram that shows how, the infectiousness of the patient starts a couple of days before. It goes really high up to, the day before the onset of symptoms, and it drops rapidly over 7 days. So I think it's fascinating that people, as you probably know, we've been doing swabs, and we were asking for two negative swabs before we allow somebody back to work. Now it turns out that these swabs were picking up either very small amounts of virus or dead viruses. So I remember I kept a patient out of work for 2 months because she kept on having positive swabs, but it turns out it was useless. It was not necessary.
Interesting.
And Debbie, to your question, I can answer that. We did receive an email from our administration on Friday that as of today, Mount Sinai is opening up for visitors in a limited capacity. We always put safety first. So visitation hours are from 12 to 4 p.m., one visitor per family, and you must wear a mask while on campus.
Does a reservation need to be made with the
No.
hospital?
No, as long as when you come in, you check in, you're here to see a patient. You just tell them which patient it is, and then they'll give you a sticker so that you can go up to see your family member.
That's wonderful, wonderful news for everyone.
Thank you.
Do we have any other questions? No? Dr. Lupa, that was absolutely fascinating. And for those of you that would like to hear all that great information again, this is being recorded and you'll be able to listen to it and understand it. Thank you so much. Thank you.
Thank you so much.
Thank you, Dr. Lupo.
Bye-bye now.
Goodbye. Now we're going to take a moment to have a talk from our mayor, Mayor Dan Galver. If someone can let me know if he's available and ready.
I'm available and ready.
All right. Thank you.
Thanks, Debbie. And thank you, Doctor. That was great. Information is power, and knowledge is power. So getting that informs you and lets you really address these challenges. I also want to thank Oscar, and it's always terrific to see Molina and Tito. You guys, music in our community is so important. It's such a part of our history and culture. And I love the fact that you all are so passionate about bringing it and delivering it to everybody, including our seniors, who really, brings up so many wonderful memories. I know, Tito, you have a history well beyond just your age of this. So we really are very grateful to you. And Molina, I can't tell you, every time I see you, or you go somewhere, the joy you bring to our community and to my favorite residents. Just don't tell any of the other residents. I know this is recorded. Just don't let anybody else see it. you really are amazing what you do for them. It's so awesome, and we'll always support you and your efforts to bring joy. I also want to thank some of the folks that, we have so many people out there who really work with our seniors. I know in my office, Gloria Campos is always there, ready to go. Um, she lived at Four Freedoms for a long time, but she loves all the seniors. At Unidad, Victor Diaz, who's my age, we went to high school together, but Victor for so long has made taking care of our greatest generation one of his most awesome passions, and he's moved mountains and built mountains for them. Antonio at Council Towers and Magnolia and Rebecca, every time I'm there, they're just so thoughtful about their residents. And of course, Miguel with the Housing Authority does so much. So I just want to thank our team for all that they do. I do believe we're judged by how we treat our seniors. I think that, I was taught to respect people, especially people who have given so much. And so I want to thank the folks that do that, like Molina and Tito and so many of the others. So I want to just talk for a second. I want to stress something to everybody. Our city, some time ago, during the middle of this pandemic, decided that we were going to make sure that our most vulnerable to the pandemic had access to the vaccine. So we did something that I don't think another city has done. Most places that have the vaccine are partnering with the federal government or with the county or with the state government. But there are really no cities that are doing the vaccine themselves because they don't have the ability to do that. They don't have people in city staff who can give injections, and they don't have access to the vaccine, which needs to be incredibly cold and kept in not just in a cold environment, but a industrial cold environment. So about 5 or 6 months ago, the city rented these industrial refrigerators, and we began to train our fire department and other personnel to certify them as people who could give the vaccine. We then figured out how to get some of the vaccine in the chain of supply. So for many months, we have been receiving 1,000 vaccines a week, and no other city's doing that. We decided to start a program early on that would make sure that all of our seniors had access to the vaccine as soon as possible. My view has been that the moment you get that vaccine, you should feel a bit of relief, because there is danger when you're not vaccinated. But once you're vaccinated, that danger is gone. And for many who have been unable to do the things we love to do, like dance with Molina and Tito, go to the events we have at the convention center and elsewhere. It's freedom to have that vaccine. So we wanted to get it to you. So what we did, if you weren't aware, is we first started to obtain appointments at Mount Sinai, and then we would take buses of people from some of the congregate living communities to their appointments and bring them back, just to make sure that people who might not otherwise be able to get that vaccine had it at a place like Mount Sinai. But then we did something even more spectacular, which is we started to deliver the vaccine ourselves through our fire rescue personnel, and we also received a bunch of nurses and other folks from the Department of Health to help us deliver it. So we went to our congregate living communities in their lobbies, Rebecca Towers, Four Freedoms. We started to actually bring people downstairs, and our firemen and personnel would literally give them the vaccine. Our Maria Ruiz and her folks would take care of a lot of the administrative parts. Many volunteers, like from SAVE and other groups, came and did the administrative work, because there's quite a bit of administrative work. It wasn't 5 or 6 people, it was dozens and dozens, 30 or 40 or even 50 people. And then Victor Diaz and Unidad decided that they would become the major pod. And we have been bringing people over there, and they're all city staff, and they're all city residents for the most part, getting the vaccine. I'm very proud that probably right now about 85 to 90% of our seniors have been vaccinated. That's a very high number. It's higher than the state average. It's higher than other cities and other counties. And most of the people we went to were people who might not have emails or might not have access. We went to all of our faith leaders. I called up all of our rabbis and priests and said, who do you know that might have trouble getting the vaccine? And a couple of them said, well, we have what's called a phone list, which is someone who doesn't have an email. And they called those folks up and they brought them to a pod to get the vaccine. We also went to our schools, public and private, and made sure all of our school personnel were vaccinated because it's so important to get our children back. And plus, the more people that are vaccinated, the less people are carrying the virus. So we did what I believe was an incredible effort. When I challenged the city to do it 4 or 5 months ago, I thought they could do it, but I can tell you that how our city staff responded was spectacular. We went into a homebound program, and if you cannot get to a vaccination pod or you can't go downstairs when we're in your building, we'll come up to your room. And as one elderly resident told me, she said, "Thank you for sending such a handsome fireman to my apartment to give me the vaccine." And so we'll send you these young people to give you the vaccination in your apartment, in your room if you need it. Because here's my point, and I want everybody to listen very carefully. We need to get vaccinated. You need to get vaccinated. And I'm going to say this over and over again. Everybody needs to be vaccinated. In a few weeks or months, we're gonna get back to normal. We're gonna start having parties again. We're gonna start, dancing with Molina or dancing to Tito's. We're gonna do all that again. But you need to be vaccinated by then. When I was at Rebecca Towers one morning, helping some folks onto the bus, I saw one of my friends there, and I said, "Are you getting on the bus?" And he said, "No, I don't want to take the vaccine because I'm afraid I'll get the flu." And I said to him that was a mistake. That's not what you should be doing. You need to get the vaccine. So if you've gotten the vaccine, thank you, because not only have you made yourself healthier, but you have made other people healthier because now they won't catch it from you. And on the other hand, if you know somebody who has not gotten the vaccine, I want you to tell them they need to. I want you to tell them how important it is. If you have a friend who hasn't done it, let us know. We will get them to a place where they can get the vaccine. If they can't leave their apartment, maybe because they're in a wheelchair or for another purpose, we'll send a handsome fireman to their apartment, and he will give you, or she will, a beautiful or handsome fire personnel will come and give you the vaccine. Our fire personnel, our firemen and women have leaned into this with such courage and enthusiasm. They say it's one of the best things they've ever done because every person they vaccinate is one less person at risk. So my goal as mayor is to have not 85 or 90% vaccinated. I want 100% of us vaccinated. I want every single senior, every single person who has given so much to our nation, our community, who has been such a good neighbor and such a good resident, to protect themselves and their community by getting the vaccine. It's not good enough that 90% or even 95 or even 99% are vaccinated. 100% of us have to be vaccinated, especially people over 60 and 70 and 80. You are our greatest generation, and we want you to enjoy our city because we're going to continue to do the things we've been doing. We're going to get back to those huge parties where we're dancing the Congo line. We're going to get back to big bingo games where I never seem to win, never once. We're going to get back to all of the things that we do that make this not just a place we live, but a place we love, where we get to hug and embrace and enjoy each other and hear each other's stories and interact with each other together and not separate. That's coming. But if it's coming, you need to be vaccinated. You need to protect yourself. You need to protect people you love, your friends, the people nearby. We'll continue to do all the things we do, our senior meals program, our parties, our fiestas. Gloria's going to take you to the ballet and to the movies again. We're going to go to the Marlins game. We're going to get you out there, but you got to prepare and protect yourself and everybody else. So my message today is, number one, get vaccinated. Es muy importante. Todos reciben la vacuna. Did I say that right? Pretty close? All right, I just said that now. You know, I'm not, my español es un poco, mi mamá maestra de español, pero tu hijo es un muy malo estudiante. Pero es muy importante, todos reciben la vacuna. Please, please, please. It's so important. So next time, God willing, when everybody's vaccinated, in a short period of time, in a month or two, or whenever it's going to be, I'll see you again, and we'll put snow cones outside your places so you can have that. We'll bring you roses, we'll send you cards, but we'll most importantly come together as a community as we get back to what we love to do, which is enjoy one another and enjoy the beautiful place we've all created here together. Because the most important thing are the people that are here, and that's you. So thank you very much, and thank you for giving me a moment to speak, Debbie. And I'm sure that Molina and Tito are going to do something that's far better than what I've said. But I want to thank them because they are the great ambassadors of our city. Because we are a city of culture and music. Have a great day, everybody.
Mayor, you have been a great leader for all of us through this horrific time. And Miami Beach has been the most progressive, most prepared, ready with the refrigerator trucks. And we all appreciate the amazing hard work and dedication, hours that have been spent, public relations, communications, and everything to protect all of us. Thank you.
My privilege, always.
Thank you.
Have a great day, everybody.
Bye-bye.
So those of you that have been listening and watching, we've been talking about Molina and Tito. So let me formally introduce them to you. Molina is also known as, if I get this correctly, La Eminencia de la Salsa. Yes. For her upbeat, she's amazing. Her upbeat, charming, and really caring manners towards her fans. She's established herself over the last 10 years as a champion for salsa music, and it all stands for Latin culture, Latin passion, celebration, dance and happiness. And we're so happy to welcome Molina, and hopefully you'll all be hugging and dancing with her soon. And Tito Puente Jr. It's an honor to have Tito Puente Jr., who is, of course, the son of the late Tito Puente. And Tito Puente Jr. has become an audience favorite in casinos, performing arts centers, symphony halls, jazz festivals. He's performed over 300 shows in the past 5 years. And that's quite, we are honored to have him because Tito Puente Jr. performs frequently, I would say, in our Cultural Arts District neighborhood in front of the Bass Museum in Collins Park. So we thank you for those amazing, great, fun shows. You and Molina have brought entertainment to our city, like Mayor Gelber said. We are so, so grateful to have you here and carry on the legends of the Latin music. Thank you. Molina, are you going to start for us?
Sure. Can you hear me okay?
Yes.
Great. Well, thank you guys so much for having us. First of all, we're super excited to see you guys. We don't get to see you as much now, but I know we will after we get the vaccine. Tito and I have gotten our first vaccine, so we're super excited. We got our first one. So now I will be getting mine on April 12th. And we're really excited to get it so that we can be back with the community and be doing what we love, because it's been a year and something now that we haven't been able to do it. So we want to urge everybody to get vaccinated so that we can get back to doing what we love to do, being together, being a community, and sharing time and music and love and passion and everything with everyone that we love, especially our seniors. So that's what I have to say right now. Tito, you want to say something before we start?
Sure. Hi, everybody. In the words of Mayor Dan Gelber, muchas gracias. Y and buenos días a todos ustedes. Soy Tito Puente Jr. It's a pleasure to be here. Thank you, Debbie, Oscar, and everybody on the Zoom. And of course, to the city of Miami for inviting me here. And of course, La Muñeca de la Salsa. I love Miami Beach. It's historical. It's one of those places that my father, the late great El Rey de Timbal, performed back in the 1930s and 40s and 50s. He performed at every single hotel up and down College Avenue, Washington Avenue, Ocean Drive. And it's just a city that I love so dearly and so much. And I'm glad that Molina and I have been performing for quite some time all over Miami Beach. And you guys have invited us a few times too. And I thank you. Thank you. I have so many accolades from and history in Miami Beach. It's just a beautiful, beautiful city. And again, thank you for having me this morning. Just got to give a big shout out to my man, Dan Gelber, one time. Thanks for the key, by the way. I appreciate it. I got mine right here.
I have mine too.
You got a key too. All right. You got some keys. So thank you, Mayor Gelber. We appreciate it. We thank you for the keys. We thank you for just inviting us to entertain the seniors. And those seniors are a lot of them are from Brooklyn, New York. Go figure. A lot of seniors from New York City, from Brooklyn, and from Queens and the Bronx and Manhattan. A lot of Latinos, and those transplants, those New York transplants. I love seeing them. I can't wait to get back out there and perform for you guys that music that you guys remember so much, that mambo music. So again, thanks again for having me.
Right. So this morning we wanted to talk a little bit about Tito Puente, Tito's dad, and Celia Cruz, and the female singers that he sang with. That I know that a lot of our seniors went to see them live, in person. So for us, it's really important. Our mission as a duo, or whatever you want to call it, as a group. We're not really a group, but we're like a duo, right? So so we wanted to keep this legacy alive. So that's what we wanted to talk a little bit about today. Tito knows a lot more about this subject because he lived with Celia Cruz. Celia Cruz is his godmother, was his godmother. So, I wanted Tito to share a little bit of the insight that he had growing up with his dad and Celia Cruz. And I think he could probably say it. I've heard him say it a million times, but I'm sure he could share it much better with everyone. So go ahead, Tito.
Okay, well, of course, those of you who might not know, my father was very popular in the Latin music world as the king of Latin music. He passed away 20 years ago, but I've been continuing his legacy and his music for the past 20 years. We perform many times on Miami Beach, and if you are a transplanted New Yorker or from Jersey or from the Northeast and now live on Miami Beach, you well know that Tito Puente was a mambo king and a legend of his time. Celia Cruz was the queen of Latin music. Our beautiful, beautiful Cuban community down here in South Florida embraced Celia Cruz. She lived down here as well, as being from Cuba, but transplanted to New Jersey, New York, and then down to Miami. But she was an incredible soul, and she was the queen of Latin music. And my father, being Puerto Rican descent, loved Miami. I actually happen to be a South Florida resident for about 37 years now. But I never lost my accent. You could tell. How are you? But notwithstanding that, most of the fans that my father loved so dearly have moved down to South Florida and on Miami Beach. And he has a lot of old friends that he had. Mr. Larry Harlow from the Fania All-Stars had a place down in Miami Beach. Bobby Marin. I could go on and on with the fantastic musicians that now make Miami Beach their home. A lot of retired musicians, but they are still there. And I'm glad that my father had the opportunity to work with them, and I had the opportunity to work with them after my father's passing. But Miami Beach seniors, you guys are fantastic. I've always loved when my father performed at the Thunderbird and the Eden Rock and all the hotels up and down the Strip. And he did so many classic places that are, some of them are still there and some of them are no longer there. But he performed since the 1930s all the way till the 2000s, and performing at probably every hotel and every restaurant as well. Probably we've eaten at probably most of every restaurant on Miami Beach. We just love the place. It has a place solely in the hearts of many Mambo and Latin music fans worldwide. Hopefully, maybe one day, if you guys will decide and the city could do something in honoring all these great musicians that have lived on Miami Beach. Not just my father, but there's so many talented people living in this city, living in Miami Beach. It's such a fantastic place. And I love the fact that the Jackie Gleason Theater still stands today. My father, I think, probably inaugurated the place and it's still there, and it still represents the talent that came from Miami Beach and still resonates there today. So again, thanks for all the seniors. Thank you to all the fans. And thank you to the city too. We did a concert last year. It was the 20th anniversary of tribute to Tito Puente. And we did it in the Women's Club right there in Miami Beach. It was a fantastic opportunity. We were going to actually go on tour before the quarantine happened. We were going to do a 15-city nationwide tour and then a worldwide tour after that. And of course, that got canceled because of coronavirus. However, the city of Miami Beach stepped up. They wanted us to bring that concert to the world. And we got the great opportunity last September, along with Mayor Gelberg presenting me with a proclamation and the key. Molina and I got to perform for everybody, including our seniors, in a virtual concert in Miami Beach. One of a kind. I still remember it like it was yesterday, because it was the last time I actually performed. And Molina probably as well. The last time we did like a full-fledged concert. So I'm going to say that was our tribute to my father and a tribute to Tito Puente 20-year anniversary concert that you would have seen around the world with Molina and myself. And we got that great opportunity to do it in no other place but Miami Beach at the Women's Club, which was a fantastic, beautiful day of just music and mambo. You guys can still see that. I believe it's online. And again, the city was the only city that I wanted to do it in. And it was the city that stepped up and said, we want to entertain our seniors. We want to entertain the people of Miami Beach, and we want to entertain the world, because it was on a worldwide platform. And that was something really special and for me. And I cherish it. I thank the city of Miami. And again, I want to be able to get that vaccine, go out there with Molina and myself and perform for the city and the folks at Miami Beach, the residents of Miami Beach, especially the seniors, those who are fans of Tito Puente after all these years. Muchísimas gracias. Thank you to all those fans. They're still with us. Those who are still with us, they can still mambo and cha-cha-cha, even into their elder years. I love it. I'm trying to get my mom to move down here, who happens to be a senior as well. So we're going to find a nice little condo for her on Miami Beach somewhere. And I'm looking forward to her coming down and celebrate this great, great, fantastic city. Molina. Man, I want to hear your beautiful voice.
Sorry.
I want to hear your beautiful voice always.
Sorry. Well, Tito, I prepared a little song, so if you can get like your campana maybe or something.
No me diga. Oh,
yeah. So we're gonna sing a little bit. We're gonna sing Mi Socio for everybody. I don't know if you got your campana. You got it?
I don't have campana, but yo tengo los palitos ahí.
Los palitos. Okay.
We're gonna try this, folks. All right. We'll do a little
Well, you guys tell me if it sounds good. All right. Here we go. We're gonna sing our song Mi Socio for you guys.
Okay.
And we just want to say thank you to everybody that always thinks of us. Debbie, Oscar, Diana, the mayor, of course, everybody that's always helping us to keep this music alive with our seniors and everybody. So we're super grateful, and I don't even know how to say thank you anymore. So I just want to give my talent, and Tito maybe can play a little sticks there. So here we go. Let's do a little morning mambo, right?
Okay. Mambo Monday. Why not?
Mambo Monday. That's right.
That's right. All right.
So here we go. Let
Got
me turn
it.
this up right here. All right. socio, ponte a gozar. Oye, mi socio, ponte a gozar. Después no digas que no te invité. Después no digas que no te invité. Al baile que va a estar sabroso. Tito Junior tocando el timbal. Y la muñeca que viene a cantar. ¡Eso! ¡Dale, Tito! Mi rumba que está sabrosa. Mi mamá toca delicioso. Goza mi prima gozoso. Que está caliente y sabroso. Se encendió Tito Puente Junior. Woo! That's right, starting off the week right. Monday in Miami Beach. Con la muñeca. And Tito Junior. That's right, Puerto Rico. Y todos los latinos, claro que sí.
¡Vaya la muñeca! ¡Así!
Come on, everybody, move it, shake it. A gozar. Ahora, Tito Puente en la nube. Un Tito Junior como la canción. Rica para el bailador, la versión sin desnudo. Todo lo puede piano y el bajo, con la comida rumba. Y ahora con el solo de Tito, le pongo la rumba. Color merece, dale Tito. Felicidad y alegría para todo el mundo, everybody have a good time. Rumba que sube, que así. All right. Llegó la muñeca con Tito. Pa' que goce. Dale, mambo. ¿Qué dice? Ahora. Vamos. A la fiesta de Tito, la cita y cita. Si usted no vino, son problemas de usted. Vamos a llegar la hora, llegó la hora. Si no bailaste, te lo perdiste, Fue para gozar. ¿Cómo? Ahí, claro que sí. Oh my God, so exciting. This is like the first time I've ever sang that virtually. Awesome.
That was hey, give it up for the orchestra, man. Give it up for the orchestra.
I know. Yeah.
My chopsticks did great today. Okay? Oscar and Debbie and everybody watching at home, you gotta understand, my wife doesn't allow me to play the drums in the house because they're really loud. So she's like, take those things and put them in the garage. And I gotta go to a studio to play. So it's very like quiet here, but I don't even have a stereo.
Right, no, my house too. I was only allowed to perform this in a 10-minute segment.
That's it.
Kevin had a meeting.
And then the dogs start barking and the whole thing, to play it, to have the orchestra come into my house, the big pain in the butt. So again, my wife already is telling me, to turn it down. Like my clave sticks are too loud for her.
But that was a lot of fun. I feel invigorated. I hope everybody watching and listening has got their body moving and grooving. Our message today, get your vaccine. If you need help, you need to know where to go. Call the city of Miami Beach and we will get someone to you. And you will be enjoying live music again soon. Thank you, Tito. Thank you, Molina. Thank you, Dr. Lupo, Oscar, Diana. Mwah. Bye-bye.
Thank you, everyone.
Bye, thank you guys. Have a
Great
great
performance.
day.
Thank you.
Mambo Monday.
Yes.
Mambo Monday.